Hi guys, welcome back to my YouTube channel. In case you're here, hi, my name is Christine and thank you so much for clicking this video. I know it's been a while without me posting a video frequently and it's due to unavoidable circumstances, but here I am and I'm glad to be here. So in today's video, we're just going to continue with our series of the caregiving program, and this is now after I am already done with the program I think 2 months ago, and yeah, so in today's video, we're going to look at the pros, that is the advantages and disadvantages of doing this course. So if you've been following, thank you so much, and please share it to someone who needs it, and always feel free to ask me questions. I always put my Instagram handle down in the description down below, and today I'll put it on the screen so that if you have any further questions, you can DM me. Also, I'm glad that a lot of you are taking up their time to contact me, and we have good conversations, encourage each other, and I'm so glad about that. At least I now have found something that I can relate to most of the people, and I came to realize that most of us, mostly Kenyans, we don't know about this course and we don't know how to go around it. So when you DM me, I usually give full information and everything. Yeah, so if you are willing, feel free to DM me. Yeah. So let's dive into the video. That was a long introduction. So yeah, let's dive into the video. So the first pro that this course has is that you are able to have the medical experience, an overall medical experience. For example, you are familiar with the biological terms, you get familiar with a lot of things, medical stuff, like when you see something, you know this is that and that. Yeah, like you have general basic knowledge about the clinical terms and clinical objects or equipment used in the hospital. That's one of the advantages. So, like for example, I am a fan of medical series, and I watch them a lot since I think after Form 4, it's been, I think, between 7 to 8 years, and I've been a fan. So I used to watch movies, and then some words would pass you like you. I didn't understand that. What does that mean? But after I indulged in this course, and now when I watch movies, you hear terms and you're like, I learned that. I know what that means. So it gives you that knowledge. Yeah. So I have my notebook here, so that's what I'm reading down here. So the next is it increases your communication skills. When you are doing your CNA or when you are a nurse aide, you have to communicate. It's one, I'm not a good communicator. That's one thing introverts like me struggle with. I'm not a good communicator, but when you indulge in this course, it sharpens your communication skills because one, you are working as a team and you have to communicate each and every time. You have to give a report almost each and every hour, each and every half an hour. So your communication skill have to be up at top notch. You have to talk to the patients, you have to talk to the nurses, you have to talk to the people in the laundry, you have to talk to the people in the theater. Like you have to communicate. So communication, it sharpens your communication skills. And on communication skills, it also sharpens your bedside manners because most of the time as a CNA, you're working with people who are dependent, like they depend on you. So most of the time, let's say for example in the hospitals or in the home care facilities, you have to be there with them. They're in the bed, you have to be there with them. So you have to know, you have to knock first before you get into someone's room. You have to say hi. You have to tell them what you want to do to them. You have to tell them you've just come to check up on them. You have to tell them I'm just coming to take your vitals. You have to communicate. Like you just can't go in and start like putting thermometers under their armpits, putting the BP machine on their hands. Like you have to communicate, you have to tell them, you have to seek consent. If they don't want, to just go and then just record the client declined, just like that. So you have to communicate no matter what. Yeah. Even the patient who is in a coma or is unconscious, you have to communicate, my friend. You have to tell them. You have to talk to them as if they are there. Yeah. Point number 3 is you interact with the patients and you have teamwork. You don't work alone, so you have to. It's a chain, like from the doctors to the CNAs to the from the doctors to the nurses to the CNAs. Yeah. So you have to work as a team. You have to flow with the team. You have to know what does the team require, what is the goal of this patient, and then you have to interact with the patient. When the patient brings stories and you're free, you have to listen, no matter how boring it is, and you have to give minimum to no. What is it called? Minimum to no. I can't remember the word, but I'll put it here when I'm editing. So you have to be also cautious. You have to encourage them because patients tend to feel lonely. You have to encourage them. You have to check up on them. You have to laugh with them. You have to feed them. Like, you have to interact with them. Yeah. So the other thing is flexibility. The other thing that is so advantageous about being a nurse is you are flexible because let's say for example you have 7 days in a week because you work 24/7. Yani the hospital has to have someone, so it's a 24/7, be it a hospital or a home care. So you are flexible. Why am I saying you are flexible? Because one, you have 7 days in a week, right? You can work for 5, 2 days you're off. You can work 3 night shifts, 2 off, 2 day shifts. You're getting me? 3 night shifts, 2 days off, 2 days shifts. Like within these 2 days, you can do another job. You can multitask. You can look for jobs anywhere else. Like you just have to plan yourself, and you are just flexible. The other pro is that you have the chance to choose if you want, or you have the chance to choose what you want to do. You have the chance to choose if medicine is the line that you want to do. I think this course is really underrated, mostly in my country, Kenya, because I would feel like it would be good if it's a must for every, let's say for example nurses, because it's in the line of nursing. Every nurse would go through the CNA part so that it's a short course. It's a 3-month course. It's a very short course. So I would feel like it would be very advantageous if it is made compulsory for nurses or those who are willing to partake in nursing to go through the CNA program or the nurse aid program or the caregiver program, so that they may have a clue of what they are going to do their entire life. You don't just have to go to school and then you're like, wow, what is this? What did I get myself into? And so you find out that most nurses are in the field and it's not what they wanted, or they got bored, or it became so hard and they dropped out. So I think this course would be nice if the country would let people do it as a compulsory course or as a bridging program to get you into nursing, because it will get you if you are eligible, if you can take it, because it has a lot. It really has a lot. Yeah. So if back then I was to do nursing like in full time, it would be something fun to do so that I would know. I would have a decision to make, like, this is what I want and I can continue. Yeah. The next thing is that another advantage that comes with this course is, and I think I've ever said it in one of my videos, seeing a patient recuperate. There's no joy like seeing a patient who came in unconscious and bedridden or shot or robbed and had so many wounds getting better, being on their feet. Like, let's say 2 weeks ago you were washing them, changing their diapers, you were feeding them using the tubes, but now 2 weeks later they can do everything themselves. They can walk around, and then seeing them discharged, there's no joy like that. Like seeing this person, you're like, wow, life is so magical. That's the main advantage for me. Like seeing someone being bedridden and now they are fully independent. That's the best joy any doctor or nurse can ever tell you that they have. And so I think that was the last pro that I had. If you have any more, feel free to put them down in the comment section down below, because people will be glad, and I also will be glad to know. Like, yeah. So we go on to the con section, which is the disadvantage. The very first disadvantage is end of life. It really triggers you if it's your first time to me, it was my first time. It really didn't disappear in my mind. I really looked okay and looked like it didn't shock me, but it did. Like, I can't forget that person. This person, and to make the matters worse, you didn't see their health deteriorating. They were just okay. Just the other minutes they were laughing with you. Just the other minute they were communicating with you, and you're like, 10 minutes later, this person is normal. Seeing their family come in and cry so out loud is so painful. Seeing this person taken to the morgue is like, wow, life is so short. Life is so, it gives you a lot of thoughts. Yeah, that's the worst disadvantage, because it's your line of work and you have to encounter such. The other con is that no matter how hard you work, CNA is among the lowest level of nursing. Not among, it's the lowest level of nursing. So you do so much work, but you are paid so little. Why? Because you're the one who is like 100 or 98% with, you spend your 98% time of the work with this patient. Like, you know their routine, you are there with them, like you are their keeper, but you're paid so little. I've already said it's the lowest position of the nursing ladder. And then the other con is that you do what people call the dirty work. Why is it called the dirty work? You have to deal with blood, you deal with stool, you deal with urine, you deal with vomit. There's a lot of things, because when a patient vomits on their clothes, you have to undress them. You have to ensure that that cloth is put in the right place, so that maybe if this person has a communicable disease or a disease that is spreading, it doesn't spread. So you have to shorten the line of infection. So you have to help them out. You have it's just termed as the dirty work. But if you love what you're doing, you do it with love and you will do it carefree. The other thing is, it's highly stressful. At first, when I was in my internship, because that's where I learned a lot, because a patient will, like, you'll end up, okay, for the first times, the very first times, you could end up sympathizing with a patient. Like, let's say they have the cannula and you have to put an IV on, so you're like, the flashing will be so painful, so is there any other way that we can connect the IV without it being painful, but you have to flash? So I was like, let's not just do that. Is there another way? So I was very sympathetic, and it used to affect me. So when I go home, I would be like, this patient is ambulant. Why did they think of putting what is it called, this thing? I've forgotten it. Why did they put how am I forgetting this thing? Surely, why? I can't remember the name. Like, why? I could ask myself a lot of questions, but then at the end of the day, it's for the benefit of the patient. So those are the pros and cons of being a nurse aide. And if you have other ones, please leave them down in the comment section below, and I will be glad to read them. If you have any more questions, find me on my Instagram, DM me, ask me questions. I might not reply immediately, but I'll try as much as I can to reply once I see your message. So finally, thank you so much for clicking onto this video. Make sure you like, comment, subscribe, and share to anyone who you think needs this information. It will be an added advantage to me. And if you're not subscribed and you're watching my videos, why are you watching my videos and you're not subscribed? Because I know you'll watch this one, watch the previous one, and watch where I started from. So please, your subscription is free and it means a whole lot to me. So yeah, I'll see you on my next video. Sorry for the crop that was croaking. Yeah, so bye bye, see you next time.